You're watching TV6 News.
You've probably heard of dementia and Alzheimer's disease. There is a difference, and Dr. Rodney Short, a neurologist with Genesis, is here to help us better understand dementia. Thanks for coming in.
Well, thanks for having me, Marcia.
All right, so let's explain what is dementia and how is it different from Alzheimer's disease?
So dementia, what the medical definition of dementia is fairly straightforward. Basically, dementia just means that there's been a progressive decline in cognition, some aspect of cognition, such as memory, language, visual spatial skills, or what's called executive functioning, problems with making decisions, judgment, attention, those type of things. But that level of impairment is affecting someone's ability to do their day-to-day activities. So they're no longer able to hold a job or maybe manage their finances or drive a car, that type of thing. So the medical definition just says that there's been some decline in patients' ability to do day-to-day activities caused by cognitive impairments.
Yeah, and when it comes to Alzheimer's disease, the difference is?
So Alzheimer's is a cause of dementia.
Okay.
If you look at the most common cause of dementia, far and away, it's Alzheimer's disease, especially later onset. So over the age of 65, 2/3 of the time, it's Alzheimer's disease as the cause.
Okay, so let's talk more about causes of dementia because there are things other than Alzheimer's disease. What are they?
Right, so when someone comes in with symptoms suggestive of dementia, we go through a medical evaluation to look for things that could be causing the dementia. And essentially anything affecting the brain can cause cognitive problems. So we usually get things like an MRI scan of the brain to look for signs of stroke or tumor or something called hydrocephalus or bleeding on the surface of the brain, things of that nature. But most of the time those things come back okay. And you also do a medical evaluation looking for any blood disorder like a vitamin deficiency or underactive thyroid to look for, again, things that could affect memory or thinking. And so there's a variety of medical causes of cognitive issues, but the most common cause, again, is Alzheimer's or related conditions, or what we call neurodegenerative diseases, such as like Parkinson's disease or Parkinson's related conditions or something called frontal temporal dementia.
Yeah.
And so there's a whole host of things that are what's called neurodegenerative, but again, Alzheimer's just happens to be the most common.
Yeah. Are you seeing an increase in dementia?
Well, we see an increase, but only because people are living longer. If you look at the age-specific rates of dementia, it actually seems like there's been a little bit of decline over the last couple of decades. And the hypothesis is that people are actually taking better care of themselves than they did 20, 30 years ago.
People exercise more than they did 50 years ago, for sure.
Exactly. Exercise and diet has actually improved some. And so we're seeing somewhat lower rates of dementia per age. And that's probably because people have less vascular risk factors, less stroke-related changes going on in the brain. But the overall incidence of dementia is going up just because people are living longer.
Yeah. So what is the advice for someone who, maybe seems a little confused? What do they do, and should they be alarmed?
Well, so the nature of memory or cognitive issues is that people who are having problems aren't often aware of it. It's just the nature of brain diseases. Yeah. And so it's usually the family that notices a problem more than the patient themselves. So if someone is having problems, the family notices a clear-cut change, then yeah, that's something that is a sign that they should be evaluated. But we see a lot of people who are the worried well, who think they're having memory problems. They come in, they want to be evaluated, and that's fine. And sometimes people are aware that they're starting to lose their memory or they're more forgetful. But really, it's if you have a friend or family that says, oh, it's something is wrong, then they probably need to be evaluated.
Yeah, and it's important because then you could have some early intervention.
Right. Yeah. So there are treatments. We don't have cures in general for most types of dementia, but again, you do want to do a medical evaluation, look for underlying medical problems that could be treated, that could help, like again, a vitamin deficiency, and you want to get a scan to see if there's any strokes, make sure that people are on the right type of stroke prevention. So, I mean, there are things that can help, and as we talked last time, there are some newer treatments that actually can slow the progression of